my name is Jara, and today I'll be performing wound irrigation. Usually we do this wound irrigation prior to putting a dressing on the patient, especially if you have an ulcer or a pressure ulcer that you want to irrigate to flush out all the debris and any exudates that's in there. For this procedure, first you would like to perform your hand hygiene technique. So wash your hands with your proper hand hygiene technique, soap and water or alcohol-based rub, and then prepare all your equipments in the room. That way you don't have to go back and forth. So for my equipment, I'll be using some sterile gloves. Then this is sterile gloves, sterile galley pot, about 3 sterile forceps, sterile gauzes, some sterile cotton balls, sterile 20cc syringe. Then this is my sterile catheter, a receiver bowl, or the one that you're going to catch on the solution, some blunt scissors or a bandage scissor, a receiver bag or a biohazard waste bag, the rubber sheet with cover, pretend this is my rubber sheet with cover, a hydrogen peroxide solution, and also saline solution, pretend this is my saline solution, and also adhesive tape. So first you would like to identify your patient using your 2 identifiers, the full name and the date of birth. So you would like to ask that patient to your patient, and then introduce your name as a nurse to your patient. That way you could already establish some rapport, and then you would like to explain the procedure to the patient. So for today, I'll be doing a wound irrigation. That way we could flush away all those any pus or any exudates coming from your wound, and we could put the bandage on afterwards. So just explain that procedure. That way the patient's also comfortable doing this procedure with you and establishing rapport as well. And then you would like to provide some privacy to the patient by closing the windows and the door. So just provide some privacy, because usually you're exposing a body part. You don't want the patient to feel uncomfortable when you're doing that. Especially some of these pressure ulcers or any form of wound are in like sensitive parts of the body. So you'd like to provide that privacy to the patient. And then first, you would like to position the patient in a comfortable position, depending on the area of where the wound is. So just make sure that you place your patient in a comfortable position. And then you would like to drape your patient, just try to expose whatever you're irrigating area. So I would just drape my patient and then just expose that area. And then put my rubber sheet with cover underneath. That way, we don't cross-contaminate or we don't soil any of the linens underneath the patient. And then after doing that, you would like to, put your gloves on. You can just use the clean gloves for this one, because you're just taking off the first layer of the dressing. So usually the first layer of the dressing, the outer layer, that's where your adhesive tape is. So you would like to just gently take that off from the patient, and then slowly exposing the second layer, inner layer of the dressing, which is this area. So you don't want to touch that area with your clean gloves. Just take this off and then get your sterile gloves now. So pretend this is my sterile gloves. And then you would like to pick up a sterile forceps just to pick up this dressing here, the inner dressing. So this is my sterile forceps. I would take that inner second layer of the dressing out, put it in a receiver bag where my biohazards are. And then after that, you would like to examine the wound, see if there's any more exudates, what color of the pus is, like if it's tender, it's swollen, things like that. You would like to do the assessment of the wound. That way, you could document all these findings in your chart. And after doing that, you would like to get your 20cc syringe. So you use this one just so you could fill your solution in here, and just place a right size of catheter corresponding to your syringe. So I would pick up my syringe and then put some hydrogen peroxide in. So according to the how many ml you would like to put in. So pretend that I do have my solution here. I would place my sterile catheter, the correct size for this, and then I will just direct this to the wound. And then if you would like to get a forceps, that way the catheter is pointed to the wound. You could maneuver this around when you're doing this irrigation. So once you point that in the wound, you slowly inject the solution into the wound, and then just like make sure that you have a receiver to get all this output of water or solution underneath the patient, and then just gently inject the solution over the wound, and make sure that you cover all the areas that needs to be irrigated. Just make sure that you flush away all that pus or exudates or anything that you can see that you want to clean up. So after putting all the solutions in there, if you need more, just get some more of the solution. Just take out your sterile catheter, and then or grab another new set of syringe. And then after doing your syringe, your irrigation, just discard this into the proper receptacle, and then get another clean pair of sterile forceps, and then get your cotton roll, sterile cotton roll, and then just gently dab this area, and make sure that you dry this area really well. That way, it's really clean, and it's ready for bandage. So after cleaning, you would like to discard that in a proper receptacle bin, and then after that, you would like to get your sterile gauze or your inner dressing, and then just put it over here. Just make sure that you don't contaminate the area. So put that over, and then get your outer cover and put it over that inner dressing, and then secure that with your adhesive tape. So pretend I just put that on, then I cut it with my scissors. And then once everything is dry and cleaned up, you would like to get all the water from the receiver, and then dump this appropriately in the proper area, like the sink or something. And then you would like to take off your sterile gloves. This is already dirty. Dispose that in a proper receptacle, and then perform your hand hygiene technique. Sit the patient up, and then place the patient in a comfortable position. Take off all of these covers. If you need to put another clean set of gloves, just put it on if needed. And then just evaluate the patient if they're okay with their position, and document all your findings, and then clean all your equipments that you use for this procedure. So that will end my wound irrigation for this procedure. Thank you, and have a good day.